My name is Jason Pohl, and I'm a senior scientist at the Pediatric Oncology Group of Ontario, and I sit on the Data Management Committee for Sipsey. And I also have the pleasure of chairing these Research Champion webinar series. The webinar series, to date, all of the previous webinars essentially are available, usually recorded actually, and available on the C17 website. So if anyone is looking for any of the previous webinars, they are available there. But today it's my pleasure to welcome Dr. Kulkarni, who's an assistant professor in pediatrics in the Division of Hematology-Oncology at the IWK Health Center in Halifax. He's cross-appointed to the Department of Hematology, and he has clinical interests in leukemia, lymphoma, and clinical outcomes and supportive care, as well as thrombosis. So today we're inviting Ketan to come and speak to us about a project that has been initiated as part of the Research Champion program, where various groups have gotten together to propose projects and then have the analysis done in partnership with FAC. And so we're just at the point now where Ketan is leading the first group, and this project is just about ready to start their analysis. So we've asked Ketan to come and present to everyone to see where this project is at, and I guess to solicit any additional people who may be interested in joining the project, or if people are interested in starting their own projects. So we'll turn this over to Ketan now, and he's going to talk about subsequent malignant neoplasms in the pediatric oncology patients. So Ketan.
Thank you, Jason. That was very kind. Thank you for giving me the chance to talk about this on this forum. I think it's a great opportunity for all of us to work with the Sipsey database. So the title of this talk is Early Second Malignant Neoplasms in Pediatric Oncology Patients. And I'll allude to the word early in just a bit. The hope is that this is going to be a national population-based study because it's based on the Sipsey database, which is our national database for under 15 children. So as we all know, in the world of pediatric oncology, that there is excellent cancer survival outcomes, and our 5-year survival rates are well in excess of 80%. So if you pull up the latest SEER registry data from the US, the last 5-year survival outcome was listed as 82%, and that really shows us that we are doing really, really well in terms of how our patients are doing overall, barring some high-risk cancer groups. But once again, as we know, there's a cost to this, and now we recognize this as survivorship. As we all know, there's a range of treatment-related side effects, both in the short term and in the long term, that can complicate this success story. This really adds to a lot of morbidity and mortality to our patients. There's well-published data from the Kayaks cohort group in BC that really highlights a lot of short-term and long-term morbidities in these cancer survivors. As we all know as well, second malignant neoplasms, hereon called as SMNs, are a well-recognized complication, and we do counsel our patients when we discuss side effects of chemotherapy. So there are large data available on long-term incidence and outcomes of SMNs in pediatric cancer patients. So if we really look at these data sets, most of them come from European countries such as the Dutch registry or German data or the Nordic registries. I think they have been further ahead in terms of conceiving these kind of one person, one record type of registries, which have really helped them to do large-scale population-based studies and give us true incidence of second malignant neoplasms or any such side effects, and even looking at risk factors. But more recently, other people are catching up, and I'm going to talk about the strengths of Sipsey, which are quite well known to everybody, but in particular in relation to this project in a bit. So this was one of the most recently published study that comes out of Korea, and they have looked at second malignant neoplasms after childhood cancer in a national population-based study. So once again, other people are learning from registry-based studies, and I thought this was quite a neat study. So this figure shows on the x-axis years from initial cancer diagnosis, and on the y-axis cumulative incidence in percentage points relative to the number of initial cancer diagnoses of second malignant neoplasms. So as we see, there's a consistent increase in second malignant neoplasms as time progresses from the time of diagnosis, and really it may be leveling out at the tail end after 15 years, but we're not too sure. I mean, that is a function of limitation of the mean follow-up periods in the registry. So the incidence is quite substantial. At 5 years, it's probably around 1%, and then at 15 years, it creeps up well above 2 to 2.5%. So this is quite a significant problem. As well, there are many other recent studies which don't address the entire cancer, which do not address the entire cohort of cancer survivors. They focus on specific subgroups. So there is data on ALL. Some people in the US have looked at germ cell tumors. Some people have looked at non-CNS tumors, and of course many other subsets of tumors like solid tumors. So different people come up with different conclusions and incidence rates, and different data has different types of limitations. I do want to highlight a recent paper on the AYA population, which was in JAMA Oncology by Keegan et al. Just came out a little over a year ago. They really show that one of the most important competing risks for death in AYA cancer survivors is actually second malignant neoplasm. So we're just really scratching the surface of understanding SMNs, I think. There is paucity of data from Canada, and the only landmark paper in this area is by Jason Pohl, who is with us today. So we appreciate your expertise on this, Jason, quite a bit. And the paper is titled as Second Malignant Neoplasms in a Population-Based Cohort Study in Pediatric Cancer Patients, with a focus on first 5 years. So this was really a pioneer paper based on the Ontario data set, because this is mostly focused on Ontario data, looking at early second malignant neoplasms. I haven't, please feel free to jump in, Jason, if you want to talk about this paper, but I wasn't going to get into details of findings, but I did want to talk a little bit about overall limitations of current literature. So really, if we look at international data, there are very few national data on all cancer types that are population-based. Those are only a handful of papers. If we look at the matter further, there's really very little international data on early second malignant neoplasm. So Jason's paper is a substantial addition to literature, but once again, it's focused on Ontario centers, which would be about 40% of our cancer patients. The hope with this project is to really expand that idea and understand if we can get a national picture of our second malignant neoplasms in first 5 years. As well, if we get into the details of currently published literature, we realize that the modeling for risk factors is highly variable. People have used different strategies to assess risk factors, and data is far from complete. We sort of know what the risk factors are, but nobody's really modeled them in sort of a definitive way to say, okay, this is number one, this is number two, and whatever else. And we know that not all national registries have a lot of data on cancer genetics and the more recent advances in cancer genetic area. So that's also one of the limitations. Also, there is very little data on the management as well as the outcomes of SMNs. So people have very elegantly shown the incidence of SMNs, but we really haven't described how we manage them, and more importantly, how they do in the long run as compared to other cancer patients. So those are some of the limitations of current literature. So coming back to the current study, as Jason explained, the background of these projects, it's really under the Sipsey Research Champion umbrella. So the first meeting happened in CYP of 2017, which was in Washington, D.C. I think there was probably 20-25 people in the room, divided into different groups, and we really had a great discussion on many different ideas. And this was one of those ideas. Several potential projects were discussed on each individual table, and people presented their ideas on how they would do this kind of study. So this study was a part of that proposal, and I know that other people across the country are doing similar other projects. So I think times are exciting for use of Sipsey data. So once again, going back to the Sipsey data, I think it's a great initiative, and as Jason said, this is almost sort of soliciting other people who are interested. So we're hoping that more and more people will join either this project or with different research questions, so we can really leverage on such a beautiful and validated national database such as Sipsey. So moving on a little bit to the methods of to the current study. So we've titled the current study as Incidence, Characteristics, and Outcomes of Subsequent Primary Malignancies or Second Malignant Neoplasms Within 5 Years of Diagnosis in Pediatric Cancer Patients in Canada. So the process, at the CYP 2017, we really sort of came up with the preliminary proposal that how the study would look like. We started quite broad. We had many different ideas flying on the table, and we said, okay, let's explore what's going on. After the meeting, we were able to generate a preliminary proposal that was circulated to all the Sipsey research champions as a call of interest, and then we received a bunch of responses for those who were interested, and then we identified a core group. And subsequently, over the last year or so, we've had a few study meetings and a lot of online correspondence at various stages. So first, we refined the proposal and circulated that, and then had a meeting to really understand if this is logistically possible, if this is feasible, if it would be of interest, and so on and so forth. And then Sipsey has a very clearly outlined process of how to apply for the data, and we went ahead and did that. And then we've heard from FAC in the fall that they would support the analysis. So thank you, all the members from FAC and Jay and everybody else. And that's how the study will proceed. So now I'll show a little bit of what we've done since the approval from FAC a little bit later. So now we are working, as Jason said, we are waiting on the data. So this is the current core group of investigators. This is not exclusive, so if you feel you could really add to the current group and have a specific expertise that can help us, please feel free to email me or Jason or any of us. So in alphabetical order, we have Jason Pohl on the study, myself, Lillian, and then Mary-Claude Pelland-Marcotte, who also has worked on similar database project before, Noel, who has a lot of expertise in SMNs, Randy, who has helped a lot with sort of tying all the loose ends and making sure everybody's on track, Sapna from Manitoba, Samuel, Sarah Israels, Ty, and then from FAC we have Diane and Lynn, who have agreed to join sort of the analysis piece of things and lead that from the FAC end. So that's the core group for now. Of course, we're happy to add anybody who's interested into this. So the aim of the present study was to really assess the incidence, characteristics, management, and outcomes. So a really broad question to understand the epidemiology and the management as well as outcome of SMNs in pediatric cancer patients within 5 years of first cancer diagnosis. So just to highlight there's no magic about 5 years. The 5-year number comes from the fact that Sipsey follows these patients for up to 5 years of follow-up. So we really are not able to have very long-term outcomes at this point. But I think Lillian is working hard on merging Sipsey or at least trying to merge Sipsey with other registries. So there could be a part 2 of this in future where we try to really answer the question in the long run. The secondary aim of this project was to assess the risk factors associated with development of SMN within 5 years of diagnosis. So we really wanted to explore different methods of modeling. We haven't sort of decided how exactly we're going to do this. We have a rough idea, but once we have first pass data, we will get into the details of modeling a little bit more. Because this is Sipsey based, this is a retrospective population-based cohort study. I think that those are some of the strengths highlighted there. It's really a national data set, so I think that really adds. So patients with SMN will be identified from the Sipsey registry among all patients diagnosed with their first cancer from 2001 to 2015. So really we are trying to leverage on Sipsey in its entire strength. I mean, that would probably include all patients in Sipsey since its inception in 2001. So we're really hoping to identify all patients eligible for this study across the country. So inclusion criteria: all patients diagnosed with a primary malignancy from 0 to under 15 years of age will be included in study. So really, as we were just talking about, this is all patients in Sipsey database. So we decided to define SMN for the purposes of this study as any patient who developed an SMN that is histologically or morphologically distinct from a primary cancer within 5 years of diagnosis. So this really ensures that we are not including anybody with a relapsed disease that's similar to the primary disease. There's another project going on relapsed disease, so that really distinguishes this as a separate project and make sure the data is clean. This is a list of variables included, so if you have any suggestions around this or feel like we've missed something, please feel free to contact us. So patient demographics with age in months and gender, diagnosis and management of both initial diagnosis of the patients who had an SMN as well as their subsequent diagnosis. So type of diagnosis, age in months at the time of initial and subsequent diagnoses. So we will still include patients who had any second malignant neoplasm. So that might include, third or fourth or fifth malignant neoplasms if there are any such patients. So we haven't really decided how to handle that piece of data, but that's the aim so far. So date of diagnosis, all details of management of SMNs such as chemotherapy, initial and SMNs such as chemotherapy with individual drug doses, radiation therapy, surgery, bone marrow transplant, and then also to focus on survival outcome with identification of survival, death, relapse, and progression as endpoints and outcomes. We are going to try and be ambitious and include genetic information available on participants and malignancies. So this is not exhaustive. This was revised recently as well in Sipsey. So this will not be all types of genetic predisposition syndromes, but whatever is included in Sipsey will be mined for this. So I think one of the strengths of this approach using the Sipsey database is that we have a very large comparison cohort. So we will be able to compare patients with and without SMNs with regard to their demographic characteristics, cancer diagnoses, underlying genetic diagnosis, if any, and then also with the treatment they receive, such as chemo, radiation, or surgery, or even transplant. So I think we will really be able to do a lot of modeling, given that we have a very large cohort of patients as control population. Thank you, FAC. FAC has kindly agreed to support this analysis for this study. So just going back to the FAC mandate and how this really works, and please feel free to jump in, Jason, if you want to say, or Randy, or anybody else, if you want to say something at this point. So FAC is really the data custodian for Sipsey, and FAC stands for Public Health Agency of Canada. So they have the mandate to analyze and publish data from Sipsey for the purposes of routine and enhanced public health surveillance and epidemiology. So really, these Sipsey research projects come under the umbrella of FAC mandate. So any project that they would deem as could be contributory to enhanced public surveillance and epidemiology would be, if I understand correctly, Jay, supported by FAC. So FAC does have another mandate to seek external collaborators with expertise in pediatric oncology who are working interested in working on impactful manuscripts. So I think that gives us a great opportunity to really try and develop some of these projects, and I know there's others in the works, so I'm hoping that we'll have a lot of time for discussion in the end. So moving on a little bit to statistical analysis. So again, this is very preliminary. We haven't seen first pass data, so this is really how we currently conceive it, but this could significantly change. So we think that for the incidence piece, we will calculate the number of person years at risk for the entire cohort as a time from date of primary diagnosis until the earliest of the second malignant neoplasm. So, we will consider the first of the SMNs as the primary event, diagnosis or death or end of follow-up period. So the censoring will happen based on those events. Then we will calculate a cumulative incidence curve, just like the study from Korea. For the development of SMNs will be generated using death as a competing risk. So we always have to control this type of data for death because that's a competing risk factor. So it does get into some complicated analysis when you're trying to identify true incidence. And I think that goes back to the need of a national population-based study because you have less confounding and less selection bias in those circumstances. So then we will calculate standardized incidence rates or SIRs by calculating the ratio of observed number of SMNs to the expected incident cancers derived from age and gender-specific Canadian population cancer incidence data from Statistics Canada. So Jason did apply a very similar method in his paper from Ontario. So I think we will learn from that and draw from that and try to keep it consistent so that data can be compared. And I think to build on the modeling, we are interested in looking at a series of models that will examine factors associated with the development of SMNs using a proportional hazard approach by using, again, person years at risk described above. So really, I think this is debatable. If anybody has a great suggestion on how modeling could be best done, whether it's by stratification or, a competing risk or whatever else it is, please feel free to contact us. Then standard methods will be used to describe outcome analysis. So I think we're most interested in defining OS and EFS for patients with and without SMN, and those will be generated using Kaplan-Meier survival curves, which is pretty much standard for most oncology studies. So this is where I think things get interesting. We think that the present data will accurately document the incidence of early SMNs within 5 years of initial diagnosis in children from 0 to less than 15 years of age over the last 15 years. So, I think the study should include about 15,000 odd patients, and we think that probably we should get somewhere between 250 to 300 unique patients with SMN. So right now we don't know if we have adequate statistical power to do a lot of modeling, but if we did get to that number, I think it should be reasonably adequate to look at different modeling methods. The data will also help us to establish the characteristics, management, and outcome of these patients, and I think that would be sort of a significant addition to existing literature if we can accurately describe this, because we don't really know what we have done with these patients and how they do. And if our hypothesis is correct, we know that a lot of these patients have cancer predisposition syndromes or a lot of comorbidities, and it's likely that they're doing much worse than control population. And then we will try and identify risk factors for SMNs, and that could lead to some improvement in surveillance and surveillance guidelines and health policy development and so on and so forth. And I think that this would be really valuable if you're able to link Sipsey with other registries so that longer-term data could be obtained, and that could really guide surveillance guideline development and sort of contribute to epidemiology of childhood cancers. Of course, this is not free of limitations. We know that, as we were discussing, Sipsey really includes follow-up data for 5 years after diagnosis. So we do not have data on late SMNs. For the purpose of this study, we are calling late SMNs as more than 5 years from the time of diagnosis. So we don't have that data, and I think we have to acknowledge that as a limitation at this point. Another significant limitation is that the AY population is not included at this time point. Sipsey does not include the AY population. Some centers are entering some of that data, but it's not consistently available to us. Given the JAMA oncology paper, I think that would be a significant limitation. We know that cohort likely has a higher incidence of SMNs than the 0 to 15-year-olds. So just as we were talking, statistical power, the anticipated number is about 300 patients with SMN, given the published incidence of SMNs and given Jason's paper from Ontario. So we still have to work that out once we really get the data. And then, of course, linkage with other registries, which goes back and feeds into point number 1, which is that we have no late data in Sipsey. So I think those are some of the limitations. And I think, so at this point, I only have a couple more slides. We don't have the data, but we have generated sort of standardized skeleton tables and some figure descriptions and some data descriptions, and we have just handed that over to FAC for the data. I'm happy to share that if anybody's interested. I thought that would be just too many slides with a lot of ghost blank cells, so I didn't put that in here, but I'm happy to share that for any feedback. So we do feel the data would be of some significance. It would be the first national study assessing the incidence, characteristics, risk factors, and outcome of early SMNs in Canadian children from 0 to less than 15 years of age for a substantial time period from 2001 to 2015. So it would really try and answer some epidemiological questions for this cohort. And hopefully that will aid in highlighting patients at high risk for developing SMNs and subsequent malignancies, and hopefully we can make some specific recommendations for management and care of these patients. So really it goes back to clinical care, and hopefully we can make some recommendations there. So I would like to thank all the core team members who have been really of great help to modify the proposal and critique it and really get it to current stage. And special thanks to Lillian, not just for her vision with the Sipsey, but also mentoring on this project, and Jason for doing your first study and agreeing to help with this one. I think your expertise is appreciated, and Randy for really keeping everybody together and making sure whatever I missed was actually done. And of course, last but not the least, FAC for agreeing to do the analysis for this study and supporting it, because I do feel that the analysis will be fairly complicated for this one. So thank you. And I think that is my last slide, so hopefully we have lots of time for discussion. Over to you, Jay.
No, I think great. Thank you very much, Ketan.
Thank you.
So I think there's lots of time.
Unmuted.
So I will just wait for Randy to unmute the callers. And I just ask that if you have noise in the background that you might self-mute, but we'll open it up so that people can ask any questions that they may have.
And line should be unmuted.
Great. Thank you, Randy. So any questions? I may start with one then, Ketan. I was just wondering, I certainly read drafts of this as it was coming through, and I didn't attend many of the planning sessions for various reasons, but I just wonder if you can tell us how long it may have taken you to basically prepare the documents and get to this point.
Yeah, I mean, I think that's a difficult question. I think if there was dedicated time, and if you're doing only this project, it wouldn't take super long. Probably in a month's time you could turn over things, but again, it goes back to competing risks. If there's hundreds of other things going, that's what takes longer. I think in reality, I think for this project, it took us probably from the time we circulated the first proposal to the time we sent it first time to the FAC, probably about 4 to 5 months. To get everybody's input and then develop the project further and then get it to FAC.
And how many hours do you think you've put in terms of that then?
That's a tougher question. I didn't keep a log of that.
It's been minutes at a time, eh?
Yeah, we try to do it as much as possible, I guess.
Yeah. I was just trying to get a sense.
What do you think? No, I think it would be similar to developing any sort of good-sized project, I would think.
Yeah, okay. I was just trying to get a sense of
I get it.
So people who want to jump in may have a sense of how onerous this may be. But I guess you can answer that as how onerous you think this might have been for you.
No, I think if data is your interest and you like to play with data, it's doable. So it's interesting actually. So I don't think it's onerous or overtly complicated to get through the system. It's just getting through the steps to sort of make sure you have everything you need. So.
Great. Are there any other questions from any of the other listeners?
I have a question. This is Saima.
Hi, Saima.
Hey,
Hi, Saima.
Thank you for a very good presentation. I just wanted to see if you have seen, so far, I think you have probably an initial data available for the second malignancies. It would be interesting, really, because we see mostly after 14 years, and you have already highlighted in your limitations. Will you see any in future incorporating data from those population too, from asking the specific registries? I know it's going to be a huge task asking specific registries, but I think we do see a lot after 15 years of age.
Yes, for sure. So we don't have our first pass data yet, but that's a great question, Saima. I think so. Not just you, but a few other people. Dr. Israels from Manitoba also brought that up. So we thought that we'll get through this first, and if we succeed in this, then that would be step number 2, to go back to either linkage of Sipsey with other stuff or go back to other registries to see if we could run similar analyses. The problem would be that there's no standardized format of reporting in each individual registry, so you may be limited by what's available in different registries, and that may not be amenable to cross-linkage across the country. So then you get into the problem of heterogeneous data. So that... So that's why I don't know, Jason, if you want to talk about that a little bit more. Or
sure. So this is Jason. So I guess just a couple of points. So I did do an analysis similar to this in Ontario, as Ketan had pointed out. And it turns out that actually there's a good proportion of subsequent malignancies that occur very early. And those actually are generally not discussed in the literature, largely because most of the subsequent malignant neoplasm data that we have comes from cohorts of at least 5-year survivors. So they basically ignore everything that occurs before the 5-year mark and then follow them. And then we don't see that the solid tumors basically don't develop until later. But the hemopoietic tumors actually develop fairly early, actually. So I mean, I think it'll be interesting to see what we see in terms of subsequent malignancies in this population. And then in terms of the long-term linkage, Sipsey is working closely with FAC and Statistics Canada, actually, to move forward with a linkage at Statistics Canada that would bring the Sipsey data into the social data environment at Statistics Canada, which would then link the Sipsey data to the Canadian Cancer Registry, along with a number of other registries and other sources of data that are national. So I think that process is happening, and I mean, I can't give you a timeline for that, but we look forward to Sipsey looks forward, I think, to having this data linked, and so subsequent projects to track these individuals long-term will be available at the national level.
Okay, thank you.
Thank you, Jason.
So any other questions? Okay, well, hearing none, I just want to thank Ketan for coming back to present this information to us and to give us an update on where this project is. There's another project that will be presented likely in the spring of another group of the research champions, so more of that information will be provided shortly. And in terms of additional research champion webinars coming up, Sipsey has recently launched what we call a flat file, so it's another way to access the data for individual centers. And so we hope to run some webinars